The medical profession is one usually open to new opportunities and change. This has been seen over time with the introduction of new technologies to improve the health sector. UNIMED Ondo has always placed emphasis on its resolve to key into ideas that will set apart its medical students from others by revolutionizing its educational system. The recent is its partnership with the Carnegie African Diaspora Fellowship Program for provision of simulation equipment to train more healthcare professionals to reduce high mortality rates of medical errors on patients. Simulations using mannequins are now considered as one of the most effective way for healthcare professionals at all levels to acquire practical skills before performing procedures independently.
How close to reality is the mannequin?
Delivering the equipment to the management of the institution, the lead trainer and facilitator of pediatric clinical care from Tulane University of Medicine, USA, Professor Olugbenga Akingbola, stated that simulation is now an integral part of medical training, adding that it provides the platform for skill training practice, error identification and mitigation, as well as create effective communication among medical personnel.
Medical education is apprenticeship. When we trained, we didn't have a simulation center, which means that everything that we knew how to do, we learned on patients. You will see that in that scenario, in that circumstance, any form of error can be catastrophic. So the advantage and importance of a simulation training in medical education is one for skills acquisition and practice, error identification and mitigation, and secondly, simulation itself provides a platform for formative assessment and also summative assessment.
In his remarks, the Vice Chancellor, University of Medical Sciences, UNIMED Ondo, Professor Adeshegun Fatusi, who described mannequins as a lifelike patient stimulator used to represent real-world patients, said the equipment will aid the comprehension of the medical students in their training.
It's going to be extremely fundamental and important to what we do at UNIMED. It's so important. And we are not just doing this for UNIMED, by the way. We are developing a standard training that any Nigerian university or any Nigerian hospital can come and benefit from. So we are developing a formal certificate in clinical simulation as part of helping the Nigerian educational landscape.
The Acting Dean, Faculty of Clinical Sciences, Dr. Joseph Fatukasi, and Director, Center for Health Professions and Biomedical Education, Professor Kayode Oshungbade, said the provision of the equipment will help improve the skills of not just the medical students, but medical professionals, thereby reducing casualties in real-life situations.
It allows, an increase in the understanding of what we are supposed to do, and it covers every aspect of medicine.
This is the direction of medical education all over the world. In our own times, we were exposed to traditional bedside teaching, but over the years, clinical skill simulation has brought some innovations to medical education.
The training is expected to last for 80 days. Joy Pius, OSLC News.